Hello students, welcome to IURage. In today's lecture, we are going to discuss about the ligaments related to the liver. So let's get started. So there are majorly two types of ligament related to the liver. The first one is the true ligament and the second one is the false ligament. So true ligaments are actually the peritoneal folds that supports the liver from all the sides so that it can be held in a particular position. And if I say about false ligaments, these are actually the fibrous remnants of the fetal life. These are the embryological remnants and they does not play any major role during the adult life. This just remains as the remnant of fetal life. And the false ligaments actually consist of ligamentum teres and ligamentum venosum, which I have already discussed in the previous lecture. You can go and check that out. And in today's lecture, we are going to discuss in detail about the true ligaments or the peritoneal folds that supports the liver. So these are the true ligament that actually supports the liver to or help the liver to be in a particular position inside the body. So the first one is the falciform ligament, then the coronary ligament, then the triangular ligament, which includes right and left triangular ligament, and last one is the lesser omentum. So let's discuss each ligament one by one. First one is the falciform ligament. So falciform ligament is actually the ligament which connects the liver to the anterior abdominal wall. It connects the liver to the anterior abdominal wall. It is derived from the ventral mesogastrium in the embryo. The falciform ligament is derived from the ventral mesogastrium in the embryo, and there are two layers of this falciform ligament. The two layers pass posteriorly and slightly to the right from the posterior surface of the anterior abdominal wall and the under surface of the diaphragm in the midline. So let's just imagine that this is the anterior abdominal wall. This is the anterior abdominal wall and this is the falciform ligament, as you can appreciate here. This is the falciform ligament. So this ligament is actually the two layers of these ligament are passing from the posterior part of the anterior abdominal wall. This ligament is passing from the posterior part of the anterior abdominal wall and it is going towards the right, slightly towards the right, and then it attaches to the anterior surface of the liver. So what is happening? The ligament is actually passing from the posterior surface of the anterior abdominal wall. This is the anterior abdominal wall, and it is passing from the posterior surface to the anterior surface of the liver, slightly towards the right, and the under surface of the diaphragm in the midline. So if this is the anterior abdominal wall and this is the diaphragm actually present superior to the liver, or it covers the liver. So the falciform ligament is actually passing from the posterior surface of the anterior abdominal wall and also from the diaphragm in the midline. Okay, so here in the midline from the diaphragm and the, or we can say the under surface of the diaphragm. If this is the diaphragm, so the falciform ligament is coming from the under surface of the diaphragm and attaches to the liver. Okay. On the dome of the superior surface, the right leaf runs laterally and is continuous with the upper layer of the coronary ligament. So what this statement says, on the dome of the superior surface. Let me erase this first. Okay. So this is the superior surface. This is the superior surface of the liver, and on the dome of this superior surface, the right leaf runs laterally. So this is the right leaf. As we can say, this is the right lobe of the liver and this is the left lobe of the liver. And so by that, this is the right leaf of the falciform ligament. And this right leaf actually runs laterally towards the right, and it continues with the upper part of the coronary ligament. Okay, So this is the upper part of the coronary ligament. So what the right leaf does, it becomes continuous on the superior surface of the liver laterally with the coronary ligament. The right leaf of the falciform ligament becomes continue with the coronary ligament on the superior surface of the liver towards the right, and the left layer turns medially and is continuous with the anterior layer of the left triangular ligament. Okay. So here this is the left leaf or left layer of the falciform ligament, which becomes continuous medially here, and it becomes continuous with the anterior leaf or the anterior layer of the left coronary ligament. Here left coronary ligament is present, sorry, left triangular ligament is present. So the left layer of falciform ligaments goes medially and becomes continuous with the left triangular ligament, anterior layer or anterior leaf of the left triangular ligament, and the right layer of the falciform ligament becomes continuous laterally with the coronary ligament on the superior surface of the liver. Okay. And it divides the right and left anatomical lobe. This is again a very important point that I have already discussed in the previous lecture, that falciform ligament plays a major role in dividing the two anatomical lobes of the liver, which is the right lobe and the left lobe. So this is the ligament which divides the two anatomical lobe of the liver, and it contains ligamentum teres in its free margin. As you can appreciate here, this is the free margin of the falciform ligament, and in this free margin the falciform ligament contains the ligamentum teres, which is the false ligament of the liver. I have already discussed it in the previous lecture, what is ligamentum teres and where it is actually located. So these all are the important points related to the falciform ligament, that this connects liver to the anterior abdominal wall, and it is derived from the ventral mesogastrium, and there are two layers of the falciform ligament, and these layers pass from the posterior surface of the anterior abdominal wall and attaches with the liver, and also from the under surface of the diaphragm, and then it attaches to the liver. And the right layer, the right leaf or right layer of the falciform ligament goes laterally and becomes continuous with the coronary ligament, and the left layer or left leaf of the falciform ligament goes medially and becomes continuous with the anterior layer of the left triangular ligament. These are all the important points that you have to keep in mind regarding the falciform ligament. Moving on, the next one is the coronary ligament. So coronary ligament is actually formed from the reflection of the peritoneum from the diaphragm on the superior and posterior surface of the right lobe of the liver. So by this statement we can understand that coronary ligament is present only on the right lobe of the liver. And where it is coming from? It is actually the reflection of peritoneum from the diaphragm. So this is the diaphragm. As you can appreciate here, this is the diaphragm, and this coronary ligament is actually coming from the diaphragm on the superior. So this is the superior surface of the liver, and behind that there is a posterior surface of the liver, and coronary ligament is coming from the diaphragm and attaches to this superior surface and also to the posterior surface of the liver. And coronary ligament again has two layers, anterior and posterior layer. So these anterior and posterior layers encloses the bare area of the liver. So what is actually the bare area? Again, very important point. The bare area of the liver is actually the area which are devoid of peritoneum. That means there are no peritoneum present in that layer or related with that area. And this bare area of liver which is devoid of peritoneum, is enclosed by these two layers of coronary ligament, which is the anterior and posterior layer. Okay. On the right, the two layers converge laterally to form right triangular ligament. So, this means that the coronary ligament towards the lateral side or towards the right, both the layers of the coronary ligament, which means the anterior and posterior layers, converge, that means fuses with each other, and they form the right triangular ligament, which will be present here. And on the left, the two layers meet to form the left triangular ligament. So, towards the left, these two layers meet to form the left triangular ligament. So, it is very clear that the coronary ligament itself forms the right and left triangular ligament. The anterior and posterior layer of the coronary ligament fuses towards the right or towards laterally to form the right triangular ligament, and they fuses towards the left to form the left triangular ligament. And coronary ligament is attached to the liver on the superior surface of the right lobe and also on the posterior surface. Okay. So, now let us understand what is bare area of the liver. So, you can appreciate here in this picture, this portion is actually the bare area of the liver. This portion is actually the bare area of the liver. And what are boundaries of this bare area? I have already mentioned that bare area is actually the area which are devoid of peritoneum. That means no peritoneum is present or attached in this area. And the boundaries of bare area includes the superior boundary is formed by the upper layer of coronary ligament, as I have already mentioned in the previous slide, that the coronary ligament is present on the upper superior surface of the liver. So, upper boundary is formed by the coronary ligament or upper layer of the coronary ligament. Inferior boundary is formed by the lower layer of the coronary ligament. So, I have already mentioned that the two layers of coronary ligament, which is anterior and posterior, and they covers the superior surface and posterior surface of the liver. So, by posterior surface, in posterior surface there are two layers of coronary ligament. The first one is the upper layer and second one is the lower layer. And the upper layer of this coronary ligament forms the upper boundary of bare area, and the lower layer of the coronary ligament forms the lower boundary of bare area. Okay. So, upper and lower boundaries are formed by the coronary ligament. Then there is right boundary. So, the right boundary is formed by the right triangular ligament. As I have already mentioned that the two layers of coronary ligament, which is the anterior and posterior layer, fuses towards laterally or towards the right and forms the right triangular ligament. So, both the layer fuses to form here the right triangular ligament, which also forms the right boundary of the bare area. And the left boundary is formed by the groove for inferior vena cava, as you can appreciate here in this picture. This is the groove for inferior vena cava where the inferior vena cava is actually placed. So, this forms the left boundary of bare area of the liver. So, these are all the important boundaries that you have to keep in mind regarding the bare area of the liver. The upper boundary is formed by the upper layer of coronary ligament. The lower boundary is formed by the lower layer of coronary ligament. The right boundary is formed by the right triangular ligament, and the left boundary is formed by the groove for inferior vena cava. And bare area is actually the area which does not have any peritoneum attached with it. Okay. Moving on. Now, we will see what is left triangular ligament. Left triangular ligament is formed by the fusion of coronary ligament layer, as I have already mentioned that the coronary ligament layer, which is the anterior and posterior layers, fuses with each other on the right side and forms the left side and forms the left triangular ligament. It is present on the superior border of the left lobe of the liver. As the name suggests, it is definitely present on the left lobe of the liver and also on the superior border of the left lobe of the liver, because the coronary ligament is passing from the undersurface of the diaphragm on the superior surface of the liver. Medially, the anterior leaf is continuous with the left layer of falciform ligament. I have already mentioned this in the previous slide of falciform ligament, that the left layer of the left leaf of the falciform ligament continues medially with the anterior layer of the left triangular ligament. So, which you can appreciate here also, this is the left layer of the falciform ligament which is becoming continue with the anterior layer of the left triangular ligament. So, this is the anterior layer of the left triangular ligament, and the posterior layer of this left triangular ligament is continuous with the left layer of the lesser omentum. So, here the posterior layer as you can appreciate here, this is the posterior layer of the left triangular ligament. This becomes continuous with the left layer of the lesser omentum. Lesser omentum is attached on the inferior surface over the porta hepatis, which we will discuss in the further slide. So, with the left layer of that lesser omentum, the posterior layer of left triangular ligament is continued. And an left triangular ligament is also an important stabilizing factor for the left lobe after excision of the right lobe of the liver. So, during hepatectomy, if there is removal of the right lobe of the liver, these ligament, which is the left triangular ligament, plays a very important role for as a stabilizing factor for the proper placement of the left lobe of the liver. Okay. So, this is an important point that you have to keep in mind, that after the excision of the right lobe, left triangular ligament plays an important role as a stabilizing factor for the left lobe of the liver. So, that is all for left triangular ligament. It is formed by the fusion of coronary ligament layer. It is present on the superior border of the left lobe of the liver, and medially it is continuous with the left layer of the falciform ligament, and posterior layer of this left triangular ligament is continuous with the left layer of the lesser omentum, and it is an important stabilizing factor for the left lobe after excision of the right lobe of the liver. Moving on, now we will discuss about the right triangular ligament. It is also a very short ligament and formed by the fusion of the coronary ligaments layer. Okay, the anterior and posterior layer fuses on the lateral side towards the right to form the right triangular ligament. It lies at the right lateral limit of the bare area of the liver. As we have already discussed, it forms the right boundary of the bare area of the liver. As you can appreciate here, this is the right triangular ligament. We'll see, we are seeing the small portion of the right triangular ligament which forms the right boundary of the bare area of the liver. Bare area is present on the posterior surface. So, this is the right triangular ligament. And the last one is the lesser omentum. Lesser omentum is actually the double layer of peritoneum that extends from the lesser curvature of the stomach and proximal duodenum to the inferior surface of the liver. As you can appreciate here in this picture, this is the lesser curvature of the stomach and this is the proximal part of the duodenum. So, from this portion, this double layer of peritoneum is extending and getting attached on the inferior surface of the liver over the porta hepatis. Okay. So it is attached to the lip of the porta hepatis on the inferior surface. So lesser omentum is attached on the lip of the porta hepatis, and its free margin contains the portal triad. The free margin of porta hepatis, sorry, the free margin of lesser omentum. Suppose here is the free margin of lesser omentum. So in this free margin, the lesser omentum contains the portal triad. That means the portal vein, the hepatic artery and the hepatic duct, which we are remembering as VAD. So the free margin of lesser omentum contains the portal triad. That means the portal vein, hepatic artery and hepatic duct, and the attachment of the lesser omentum on the porta hepatis or on the lip of the porta hepatis is actually L shaped. This you have to keep in mind. So that's all for today's lecture. In the next lecture, we'll discuss the next topic related to the liver. Until then, keep reading and don't forget to subscribe, like and share. Thank you for watching this video.